Are you tired of guessing whether or not a gluten-free diet is right for you? Do you want to know for certain whether or not you need to avoid gluten to maintain and achieve optimal health? If so, genetic testing for gluten sensitivity may be the answer you've been looking for. With just a simple cheek swab, you can learn whether or not you have a genetic predisposition to gluten sensitivity and celiac disease. And though this test cannot diagnose you, it can help you understand whether or not you are predisposed to developing gluten-related health issues. This knowledge can be incredibly valuable for those who are looking to make informed decisions about their diet and overall health. Researchers estimate that gluten sensitivity is much more common than previously thought. Some studies show that as many as 13% of the population is gluten sensitive. And contrary to what your doctor may have told you, gluten-induced damage is not isolated to the GI tract. Here's what world-leading expert Dr. Peter Green of Columbia University has to say about it. Recent studies are showing that gluten sensitivity may be much more common than previously thought. It may in fact be a separate disease entity that involves different organs and different mechanisms than celiac disease. The acceptance of gluten sensitivity as a valid condition has evolved. Another group of researchers from Oxford said this: gluten sensitivity is characterized by abnormal immunological responsiveness to ingested gluten in genetically susceptible individuals. Celiac disease or gluten-sensitive enteropathy is only one aspect of a range of possible manifestations of gluten sensitivity. In some individuals, gluten sensitivity was shown to manifest solely with neurological dysfunction. And that's not all. Scientists have confirmed that gluten can damage the heart, thyroid, liver, joints, bones, muscles, brain, nerves, and skin. Gluten has been demonstrated to both cause and to worsen certain types of autoimmune disease. Knowing whether or not you have genetic predisposition to gluten can help you decide whether or not you should commit to the diet, as so many people experiencing autoimmune symptoms see tremendous benefits when cutting gluten out. And perhaps most importantly, genetic testing for gluten sensitivity may help you to avoid the potential long-term health risks associated with a gluten-filled diet. As I stated earlier, studies have shown that those with gluten sensitivity are at high risk for a number of illnesses. Perhaps one of the most alarming statistics comes from a study published in the prestigious medical journal Gastroenterology, where researchers found that gluten-sensitive individuals with celiac disease who continued to eat gluten had a nearly 4-fold increased risk for death. Look, gluten is no joke. This test measures both the HLA-DQ alpha-1 and beta-1 gene alleles for celiac, but unlike other online DNA tests, it also measures for non-celiac gluten sensitivity gene predispositions. So if you're ready to take control of your health and make informed decisions about your diet, you are a simple cheek swab away from knowing if a gluten-free diet can help you reach optimal wellness. everybody, welcome to Pick Dr. Osborne's Brain. If you've got questions that you'd like to get answered today, make sure you go ahead and start typing those in now. It's first come, first served basis. Of course, I'll try to take as many on the topic at hand, which is manganese. If you missed the show, the crash course on manganese this week, we'll put a link up so that you can go back and make sure you watch that informative class. And as always, remember, we are trying to reach 100 million people. And the only way we can do that is if you share. So if you like this information, make sure you hit that subscribe button, but also make sure you share it with somebody who you care about. So let's dive into your questions today. Let's see, gosh, we got an overwhelming quantity. Question on, Colleen wants to know, my mom is 78, has osteoarthritis and needs a knee replacement. And she has no cartilage left. I guess that's according, there's no such thing as not having cartilage left. It's something a lot of orthos will say, but it's never true. She has narrow joint space, but there's still cartilage. Do you recommend manganese and at what dose? Possibly, Colleen. I mean, about 10 milligrams of manganese a day to start if you have no testing is really generally pretty safe for her to take and supplement, and it might have an impactful benefit for her. But more even than just recommending manganese, I would recommend that you check out our pre and post surgical nutrition support protocol. And there are several things within this protocol that we've used clinically in patients over the last 20 some odd years that helps to expedite and expedite their recovery. So if you're looking at trying to help your mom recover from the surgery, but also helping her to have the best potential outcomes and the least possible negative outcomes, is at least as far as nutrition is concerned, that's a protocol that I'd highly recommend that you check out. We can put a link up to that protocol for Colleen. What if you're high in iron without supplementing? So you're saying if your iron levels are high but you don't supplement with iron, there are several different things. I mean, sometimes you can get, I would recheck it, because if it's a fluke on a test, sometimes you'll get an artificially high reading. It happens now and again with labs. So make sure you double verify. And if it is still high, what I would suggest is talk with your doctor about measuring to see whether or not you have hemochromatosis. There are certain gene patterns that your doctor can order and measure to say, okay, do you have an issue with too much iron in your blood creating or driving the potential for greater risk factors of disease, because too much iron is oxidative and can damage you. So the solution for most people with hemochromatosis, just so that you're aware, is bloodletting. Not like the leeches of old days, but your doctor can write you a prescription to go have your blood drawn so that you can get a kind of a regular reduction of iron through that blood loss, through that controlled blood loss, to control your iron levels and prevent the risk of that elevated iron creating possible disease issues. So another question about gluten and enzyme consumption. So the question is, can you take a gluten breaking enzyme before a meal that contains a significant amount of gluten, effectively preventing reactions? No. Anybody who's telling you, and this is a lot of companies are out there advertising that you use their enzymes so that you can keep eating gluten. Those companies are liars. They're fraudulent. You should run the opposite direction. The advice that they are doling out is dangerous. If you are gluten sensitive or celiac, the purpose of a digestive enzyme like Gluten Shield that contains PPD4 is not to allow you to consume gluten. The purpose of the enzyme is to protect you from the potential risks of cross-contamination should you get some minute amounts accidentally, but it's not to allow you to go purposefully eat spaghetti and pizza and drink a beer. That would be bad news. So, again, I always like to say, if a company is marketing their product as a tool for you to be able to eat gluten, that company should be put out of business, in my opinion. It's unethical. to say that. Okay, let's see. Advice for PCOS. I have already eliminated grains to reverse my alopecia. Awesome, Bobby. So if you've reversed your alopecia, you're on the right track. Alopecia being an autoimmune disease of hair loss. PCOS is a condition of the ovaries. For those of you that don't know what PCOS stands for, it's polycystic ovarian syndrome, and it is basically, if we want to name it in layman's terms, it's diabetes of the ovaries. So if you have eliminated grain, now you have to look toward how well your body is capable of controlling blood sugar. And there are a lot of factors and variable things nutritionally that can impact your ability to control your blood sugar. For example, chromium and vitamin B3 deficiencies can contribute to elevations in blood sugar. So those are two vital nutrients that you might want to look into. We actually have a course, a video that you can watch. Maybe we can put a link up for Bobby on that. But the name of the video is What Your Doctor Never Told You About Blood Sugar. And it's a comprehensive breakdown of the nutrients necessary to help your body metabolize glucose. And any deficiency of any of these nutrients can contribute to long-term rises in average glucose over time, which can contribute to the development of diseases like PCOS. So you definitely want to be aware of those. So starting there first. The other would just simply to be look at your ratio of carbs, fats, and proteins. Most people, even when they go grain-free, tend to gravitate towards some of the products, the grain-free products that are high carbohydrate, things like cassava, tapioca, arrowroot. You want to keep your carbohydrates around a third of your total caloric intake or less. So think of your carb-fat protein ratios as a third, a third, a third. It's a great place to start, especially if you have PCOS, because you could be over-carbing even though the carbs you're eating are grain-free. I like that. Debbie says, a world where a good doctor is not an oxymoron. She's referring to this world here. Thanks for that compliment, Debbie. What prevents magnesium and manganese from being absorbed? One of the biggest things that prevents them from being absorbed is low acid. So when people don't have adequate acid, or when people are taking acid suppression medications, like Prilosec or Zantac or omeprazole. These medicines have an inhibitory effect on how you make stomach acid, and you require acid to properly absorb both manganese and magnesium. So those are two big ways that they're not being absorbed. Now, if we're talking just about gluten, gluten-induced intestinal damage is another reason we see massive malnutrition in people with gluten issues who are not aware that gluten is the contributing factor. And so they become malnourished, unawares of that impact that gluten is having on their ability to digest and absorb nutrients from their food. Can primary hyperparathyroidism cause a disturbance of the uptake of manganese? I haven't seen anything, Barb, on that specifically, so I don't want to give you a commentary that I'm not aware of, but I've not yet come across any research on the relationship between primary hyperparathyroidism and manganese uptake. Let's see here. Let's see. Adopted son diagnosed with failure to thrive 6 years ago, but no advice except eat more, but he won't. Very small, short, for age 12. Insurance won't do growth hormone. Will manganese supplementation help? Possibly, and possibly not. I would say if your son has got an FTT issue, so technically at 12, it's probably more along the lines of not growing to the curve. I would suggest, I would suspect that the reason this is happening has less to do with the manganese deficiency and more to do with the fact that whatever your son is eating or being exposed to is contributing to hormonal disruption that's not allowing for his full potential of growth. We see this all the time in people with gluten issues, and they've not been diagnosed with gluten issues. Remember, most people that get diagnosed with gluten issues, they get the diagnosis because they have either severe vomiting, diarrhea, or emaciating type of disease, and they get a celiac diagnosis. But many kids particularly don't grow or have less growth because of gluten without the GI symptoms. So they don't have the horrific, gastrointestinal pains or aches or bloating or diarrhea. And so they get missed. Their diagnosis completely gets missed. I would suggest that you do genetic testing for your son to determine whether or not there's a gluten issue at play, because if there is, no matter how many calories he eats, if he's eating gluten and that gluten is damaging the GI tract, your child is going to suffer from malabsorption and poor digestion. And that's going to lead to the inability for the body to properly grow because it's not getting access to the nutrients it needs. When the gut can't break the food down and get the nutrients into the bloodstream, the body won't respond well. And in kids, that means less growth. In adults, that typically means chronic inflammation and lots of symptoms. I just started taking trace minerals and I feel like I have more energy. I just wonder if trace mineral drops contain all the minerals or if some are missing. It depends on the brand, depends on what you're actually using, depends on the source of the trace minerals. A lot of trace mineral drops are basically a kind of solution of different salts. I mean, they can take, for example, some companies will use salt from inland lakes, and they'll take a concentrated version of that, which is very mineral rich, without actually giving you the analysis or the breakdown of what trace and ultra trace minerals are present. That would be a question I would, if you're trying to get the answer to that, I would ask the question to the company or the product that you're using. My comments on grain-free veggies containing lectins. So, there's a lot of doctors that, make a claim that all lectins are bad. And if you're trying to overcome an autoimmune problem, that you have to be very cautious around lectins. I would say that's not always true in my experience. I mean, that's not to say that lectins can't be a problem. But it's my experience that lectins are not typically the thing that holds a person from seeing a massive improvement in their health by changing their diet in a grain-free way. So again, no, it's not an exact answer, but lectins can be a problem. Lectins can be a problem, but they're not always a problem. Do I agree that testing hormones in the urine is the best way to do it over blood, and why? So I don't think that urine testing is necessarily better than blood. I think that oftentimes hormone testing is oversimplified. The doctor will run a blood test, and if they see nothing abnormal or untoward, they'll dismiss it as a potential for the person's problem. But part of in my own practice, we use blood, we use urine, we use saliva to measure different hormones for different reasons. There's different aspects to what we want to look at, and sometimes you can get a deeper understanding of the breakdown of hormone byproducts with urine testing than blood testing. But as a general rule, that doesn't mean that blood tests are inaccurate or unhelpful. And then there are also other components to take into consideration, because a lot of doctors measure hormones without measuring vitamins and minerals. And what you want to understand is that hormones are made from nutrients, right? So if you take, as a perfect example, if you take progesterone as an example, yeah, you could measure that in urine, you can measure it in saliva, you could measure it in blood. If it's low in any one of those compartments, most doctors, their solution is to give a person progesterone to solve the low level. But I think a smarter question to ask would be, why is the progesterone low? So instead of just giving progesterone, now we have to say, okay, well, why is your progesterone low? Is there something interfering with its ability to be produced? And so one of the more common reasons that progesterone might be low is a low level of overall calories in the diet, especially calories from fat. We'll see this a lot at fat, that under eating fat, which is very common in today's world of low fat, high carb diets, that women will have low progesterone as a result of their macronutrient deficiency in fat. Vitamin B5 deficiency can cause low progesterone. Vitamin C deficiency can cause low progesterone. Vitamin D deficiency can cause low progesterone. So without measuring those reasons as to why progesterone might be low, to me it's always more important to measure nutrition than it is to measure the upstream hormone, because the upstream hormone is made from nutrients. And if you don't understand whether or not a person is adequate in their nutritional status, then you're just shooting in the dark at adding hormones to a person's care, and they may not actually need the hormone itself. So you're not solving the problem. Again, it goes back to the standard model of allopathy in the world is see symptom, treat symptom. Remember that seeing the symptom of low hormones in the blood, urine, or saliva is a symptom and not a cause. There's a reason that hormone is low, and that's the answer that you want to get to. My mom is 77. For the past couple of years, her doctor put her on blood pressure pills and baby aspirin. Her leg's been aching and she's been feeling tired a lot. She also is becoming forgetful. She eats once a day, listens to her body, and never feels hungry. She's been that way all her life. I suspect she has vitamin deficiency. I mean, the best thing to do in that situation, just generally speaking, is a good quality multivitamin. Without any kind of testing or any kind of understanding of her internal biochemistry, you just can't go wrong with a good quality multivitamin. But I would caution you and caution her both to talk to the prescribing doctor, that knowing that aspirin damages the stomach and can cause occult blood loss leading to iron deficiency. It can also cause folate, which is a B vitamin, folate deficiency, as well as vitamin C deficiency. So just some things to be aware of. One of my clients quit drinking. It's about 3 months, and her liver enzymes continue to be elevated. Any explanation for that? Yeah, if it's been 3 months and she's not drinking, there could be other foods that she's consuming that are damaging to her liver. There could also be other environmental toxicants that she's being exposed to that are damaging her liver, and so those would be some areas of investigation that that I would encourage you to take. Probably, in my opinion, one of the more common causes of elevated liver enzymes is gluten. We see it all the time. People with gluten. Gluten is notorious for causing autoimmune hepatitis, but that would be something I would look at. And then if they're on any kind of medication, remember the reason alcohol elevates liver enzymes is because you have to process that alcohol through the liver. Well, this is also true of most medicines, and so we see this a lot in people that are taking multiple medications, that their liver enzymes start to go up as a result of their liver having to process all that extra drug. I have an aunt suffering from lupus, and one of her doctors told her not to take collagen because her immune system is altered. That's an ignorant doctor, in my opinion. How do I want to answer that? One, there's no research that shows that taking collagen in a patient with lupus is the wrong thing to do. He's probably making the assumption that because lupus can come with, in some cases, can come with kind of collagen inflammatory problems in lupus patients, which lead to a lot of their pain. And so he's probably in his mind, I don't want to speak for him, but in his mind, I would just imagine that he's probably thinking that if lupus is affecting her soft tissue and her collagen, that by taking collagen orally, she would actually create worse of a problem. But that's a non-reasonable assumption to make. I would say many of the people that I've seen in years of practice with lupus issues, I've yet to find one of them that did poorly on collagen. I think the bigger issue to solve in lupus is that, what are the triggers for that person's lupus? It's one thing, maybe she's allergic to beef, and so that beef collagen would be a bad form of collagen for her to use. But as a general rule, we can't just throw collagen out the window, based on that logic. What's the best magnesium to take? It's not that there's a best one, Christine. It's which one is good for which reason. There are different kinds and different forms of magnesium, and the forms oftentimes will help dictate depending on what you're trying to accomplish. For example, the best magnesium, in my opinion, for sleep is a magnesium called magnesium threonate, and that's because threonate binds to the magnesium and helps it get past the blood-brain barrier so that it can help you support your sleep at night. So if you're trying to sleep, that's a really, really good one. If you're trying to induce bowel movements, magnesium citrate is a really great choice. And that has to do with citrate and the magnesium both being an osmotic, pulling water into the bowel. But if you're just talking about a general, overall, really well-rounded magnesium that you can take, I recommend Ultra MG. It's got 4 different kinds of magnesium in it. Again, as just a general supplement with no specific reasoning behind why you would want to use it specifically. It's just a good overall comprehensive formula. Jessica says, Dr. O, you mentioned last week that you take a food suitcase when you travel. What does yours consist of for a 1 to 2 week trip? Do you eat out, cook your own food at an Airbnb? What does a typical vacation look like for you? So for me, very typical is before I go, I always try to get an apartment, or not so much a hotel, but a place that I can get a kitchenette. So if the hotel has a kitchenette, great. I want a fridge and I want a stove and I want to be able to cook. In my food suitcase, if I'm not going to be gone for a tremendous long period of time, I'll take very easy things like beef jerky, nuts, even dried fruit, canned fish is another easy one to pack and travel with. So these are just what I would call survival food, right? Things that I could eat very stoically on a short trip that, where I could combine that with some fasting where I'm not going to, potentiate or wreck my diet. But for longer trips, I look for a kitchenette, and I also make sure that where I'm staying is there's availability for me to go to a grocery store or a market where I can, pick the foods just like I would if I were at home, pick the foods and choose the foods. So there's no magic to it. It requires a little bit more work and investigation on the upfront before you book a place, but at the end of the day, to me, it's worth it. What would cause arm muscles to constrict into frozen position after overworking? Dehydration is one, but lactic acid buildup in the muscles. So if you were working out, as an example, or if you were working hard and you were using your arms a lot, and then after you were done working, they were kind of had this pronicity for the rest of the day to cramp. The first thing would be probably you're not hydrated very well, and so those muscles are rebelling against the work. So make sure you're hydrating. Number 2 would be that when you work a muscle over a long period of time, you do reduce its storage, its energy storage, and so then it's left to rely on a substance called lactic acid, or what's sometimes referred to as anaerobic metabolism. So if you guys know what aerobics are, aerobic it means with oxygen. So generally when you're doing aerobic exercise, there's enough oxygen to fuel your muscle without it going into that burning feel and then that cramping. But if you run out of oxygen, oftentimes what will happen is the muscle will start to cramp, it will tighten up, it will have a burning pain inside of it. And so after a heavy workout, a lot of times you've depleted the oxygen and the energy store in the muscle, and so it will go into that anaerobic state. And the best way out of that is rest. Rest, hydration, and then you also might want to look, if this is happening on a regular basis, you may be anemic. Remember, your oxygen is a rate limiting factor for how your muscle generates its energy. And so some people are anemic, and this is especially true of what I see in women, and it's why a lot of women can become exercise intolerant, especially when it comes to weightlifting. It's because, especially women having a cycle every month, because they're losing blood, they're losing iron in that blood, and they're losing hemoglobin in that blood, and that hemoglobin is what's responsible for carrying oxygen to the tissue. And then you have a special kind of hemoglobin in your muscle called myoglobin, which works in a very similar fashion. So you might rule out whether or not you're anemic as well through some simple blood testing with your doc. What causes, if you mean micro, not macro, but microalbuminuria, meaning you're finding a lot of or excessive quantities of protein in the urine, that's kidney damage. what generally causes that is kidney damage. And certainly lupus is a disease that can damage the kidneys, but many problems or many things can damage the kidneys, even just beyond lupus. Again, lupus is the disease that can create an inflammatory damage to the kidneys, but you could have, for example, you could have a gluten-induced kidney inflammation. You could have toxic exposure. You could be taking certain drugs that are metabolized by the kidney and damaging to the kidney. An example of that would be, ibuprofen. What's the upper limit of magnesium before one needs to supplement with manganese? Well, just remember that the higher level of magnesium that you take, magnesium and manganese are absorbed through very similar mechanisms. So a high level of magnesium without manganese can actually contribute to a reduction in manganese uptake. So if you're one of those folks that are on 600-800 milligrams of magnesium a day, but you don't have any extra manganese, then you might want to consider that. It's one of the reasons why manganese is in our multivitamin. If you have ultra nutrients, you're getting manganese by default if you're using that particular product. It's in there for many reasons, but one of the reasons is also that we understand that the vast majority of the world online has been told they have a magnesium deficiency. I think some doctors are out there saying that as high as 80% of the population is magnesium deficient. Whether or not that's true or not, I'm not here to debate, but I think that what it does do is it turns a lot of people toward magnesium as a supplement. And not to say that there's anything wrong with that per se, but if you're on high doses of magnesium over long periods of time, you can induce or reduce rather the ability to absorb manganese. If I find pure quinoa, is there any cross-contamination effect? Yeah, I mean, quinoa can mimic gluten. So if you're gluten sensitive, there's some of the proteins in quinoa that do mimic gluten and can create a reaction. There's also the potential risk of quinoa products being cross-contaminated with gluten. Can we put for Sabrul on YouTube, can we put a link up to our quinoa article, and that may help you understand the quinoa issue a little bit better. Can hot weather trigger allergy in Asian people? Make some gluten-free diet plan for Asian people. So yes, hot weather can be a trigger, not simply because hot weather is the cause. A person should be able to tolerate hot weather, but hot weather is a form of stress, and when a person has an overwhelming quantity of stress, sometimes that hot intolerance to heat is the proverbial straw that breaks the camel's back, but no one is actually allergic to sunshine. I think that sometimes is touted out there and it's a myth. Now, certain drugs can make you more sensitive to the sunlight, and behaviors, your dietary behaviors can make you more sensitive. And of course, overwhelming quantities of stress can make some people sun intolerant, but it's not the sun that they're really reacting to. It's just that last layer of stress they can't handle. What supplements for stiffness? Is it worse from it is worse from insomnia and pain waking up in the small hours? I mean, you can take supplements to help support muscle relaxation. I mean, probably one of the best is magnesium. It's a natural muscle relaxer. Calcium actually can help relax muscles as well. So like a CalMag combination would be potentially helpful in that situation. But the bigger question is why the insomnia and pain? So again, you can use a supplement to treat the symptom, so to speak. I mean, technically it's not treatment, it's to support the body. But at the end of the day, you want to know why the symptom exists, and no amount of supplements, I mean, unless you have a calcium and magnesium deficiency that's causing you to be stiff, that might correct it and correct the reason why you're stiff. But if there's an inflammatory reason as to why you're stiff, taking calcium and magnesium may not be the long-term answer. My 9-year-old son has bad breath and I can't get rid of it. What could it be? It could be dysbiosis in the gut, including candida or SIBO, as you've asked or stated in your question. It could also be the wrong food. One of the big causes of halitosis is eating food if somebody's eating food they're reactive to, what happens is it recruits into the tonsils, it recruits white blood cells. And then the byproduct of that, it forms what are called tonsil stones, which are these little pustule pockets of pus and other immune debris that can cause horrendous breath. And so that you might ask yourself whether or not your son could be being exposed to foods that he's reactive to. Can I give yeast shield to a 9-year-old? You can, depending on his weight. If he's anywhere between, I'd say if he's 50 to 100 pounds, 2 to 3 capsules a day should be perfectly fine and safe. If he's less than that, I would work with a doctor to get dose titrated properly. How many days do you take intestinal defense if you're trying to do a parasite cleanse? Yeah, I would do it for the full course. So for the full week is what I would recommend in that situation. That's the way we do it, and that's the way we have our animals do it. So for the full week of that full moon. Is manganese or CoQ10 dangerous to take when you have hemochromatosis? No, neither are dangerous to take. Hemochromatosis is an iron issue, not a manganese issue. I was prescribed propylene glycol eye drops and omega-3s for extreme dry eyes. What causes dry eyes and what do you recommend for it? Lots of things cause dry eyes. I would say, I don't know, Joy, whether or not you were diagnosed with Sjogren's syndrome. It's a condition, an autoimmune condition where your immune system can create antibodies against your own tear ducts, creating severe dry eyes because it damages your ability to produce tears. That may be something you want to get clarity on. You can follow up with your doctor to get clarity on that. If we're talking about an autoimmune response, and if you're talking about an autoimmune response for dry eyes, no amount of propylene glycol eye drops or omega-3 are going to reverse an autoimmune process per se. You have to look at the triggers of autoimmunity, and those 4 categorical triggers are what? They're food, chemical exposure, nutritional deficiency, and microbial imbalance. And so a good doctor working from the premise of a functional philosophy could test you appropriately to understand which of those 4 categories are triggering you, if indeed you do have an autoimmune induction of dry eyes. Now, and in my experience, most people that suffer with extreme dry eyes to that level do have an autoimmune process behind it. So that would be what I'd highly recommend you go and follow up with your doctor on. Can manganese deficiency cause hemorrhoids? I've never seen manganese deficiency be the primary driving cause of hemorrhoids, and that's not to say theoretically that we couldn't draw a connection, but it's just not something I've seen as a clinical outcome in people with manganese deficiency. So how much iron and manganese can you recommend to my friend? She lost much blood because of hemorrhoids and got blood transfusion, but is all still too low. Your friend is not. You can give her manganese and iron, but her problem is she's losing blood through damage to her lower large intestine. That's what hemorrhoids are, an inflammatory illness that it can oftentimes is caused by a person's diet choices. So your friend needs to figure out what it is that she's eating that's driving the production of hemorrhoids. It's causing her to lose that blood through her stool, which is causing her to become anemic and need blood transfusions, because no amount of iron or manganese in the world and supplementation is going to correct that if she continues to have bleeding hemorrhoids. What happens if you get too much manganese? Not likely, but just a curious question. Neurological damage is a consequence of manganese toxicity. So, I would say, not common in my experience, and I regularly, when we test people, Russ, we'll see manganese deficiency, anywhere from 15 to 20% of the time in folks. And, I'll regularly put them on 20 milligrams of manganese a day as a starting place. I've yet to see clinically anyone ever suffer from manganese toxicity. So that would be, again, just my 2 cents on manganese. But that being said, could a person become toxic? Yeah, there's always that potential risk. So just be aware, typically it's neurological damage. Why do so many people want to manipulate wheat in 10,000 different ways and then ask if it's gluten-free? Look, if you're eating wheat, it's got gluten in it. So quit trying to eat wheat or make ways to eat wheat. I don't know, I'm not trying to pick on you, Elsie. It's just the question gets frustrating after time when so many people, it's like, is sprouted wheat okay? Or, is einkorn wheat okay because it's an ancient grain? No, if it's wheat and you're gluten sensitive, I don't care what's been done to it. I don't care how they've treated it. I don't care what kind of voodoo wand of magic they've waved over it. If it's wheat, it's going to have gluten in it, and you should avoid it at all costs if you have gluten sensitivity or celiac disease. Yeah, and the manufacturer claims it's gluten-free, but think about the intelligence of that. I mean, let's think about 2 things. So again, not trying to pick on you, Elsie. Number one, look at the last, 60 to 70 years of food production in industrial countries, and look at how that as a whole, look at how different food companies have lied, cheated, stolen their way to the top without regard for your health. Like, it's one thing to be out in a business and have profitable business models so you can feed your family, but when you put profits ahead of people's health, it's time to reclaim your food. I mean, look at the companies that have been producing the food, and look at all the different forms of processed food, and look at all the claims that they've made over many, many years that have come back to be wrong. I mean, just look at, prime example would be hydrogenated seed oil sold as margarine as good for people and butter as bad for people. Like, this is the food manufacturing industry telling us this because they want to sell you more cheap, easy to process stuff that gives them a huge profit margin regardless of your health. And if you're eating a product that, even though it's made from wheat and claims to be gluten-free, first of all, there's no such thing as gluten-free wheat. So really, for them to be making that claim, to me, already poses a super hyper ethical question as to that. But the other is, can you trust them? I mean, one of the reasons the question came back to me a minute ago, which is, what do I do when I go on vacation or when I travel? And generally speaking, I try to control my food. Why do I try to control my food? Because I don't trust, excuse my language, the assholes who we've been trusting for the last 60 or 70 years to be trustworthy with producing the food that they were charged to produce that is now poison, right? How many people are sick? I mean, just look around. In the U.S. alone, 46 million people have an autoimmune diagnosis. 1 million die from heart disease a year. 1 million die from cancer. The third leading cause of death, it's close to like almost 400,000 people a year die from drugs, from the very drugs that are being prescribed by the very doctors that are treating the cancer and treating the heart disease and autoimmune disease. So, the food industry makes you sick. The drug industry makes you pay, right? And everybody's making money. Nobody's got really the concern for you except for you. And so I just go back to what happened. This product that they're claiming is gluten-free, that you've used, but your zonulin is testing over 1,000, I would say that should be enough for you to understand that maybe what they're saying is a lie. And then also what you said about maltodextrin. Maltodextrin, there are 3 main places we're going to see maltodextrin derived from, actually 4. Wheat is you can get maltodextrin from wheat, you can get it from corn, you get it from potato, and you can get it from tapioca. Those are the 4 main places, today, and if you're looking at food manufacturing and where they would derive their maltodextrin from. And from a gluten perspective, the potato version and the tapioca version are both going to technically be gluten-free. The wheat version, not so much. The corn version, I don't recommend either. So you could possibly also be some of the supplements that you're taking. So again, this is one of the reasons why you You don't want to buy your supplement. If you're gluten sensitive, you don't want to buy your supplements from companies who don't understand these things, because at the end of the day, if they don't understand it, they're gonna sell you something, not necessarily with the intent of harming you, but the road to hell is paved with good intentions, and sometimes it's not their intention to hurt you, but it's their ignorance that does, and you don't want to fall victim to someone else's ignorance because they don't understand the topic better than you do. Okay, my friend has neuromyelitis optica. She takes prednisone and goes for some kind of drug infusion twice a year. They never tested her B12 or vitamin D. Could this disorder be due to deficiencies or gluten? Absolutely. Look, it's an inflammatory disease of the optic nerve. That's what neuromyelitis optica means. It's nerve, myelitis, inflammation of such nerve, and optica meaning eye. So you have the optic nerve that feeds the eye that is inflamed. And so they're using an immune suppressant, prednisone, to stop the inflammation, and they're using probably a biologic twice a year to suppress her immune system's ability to function, to make sure that she's less symptomatic. But vitamin D deficiency is a trigger for autoimmune disease, and there are a lot of reasons why the nerves can be inflamed, and gluten certainly is on the top end of that list of suspicions. Mold is another big one I've seen cause neuromyelitis and eye dysfunction and inflammation. So yeah, I would definitely look at those as potentials. Can manganese deficiency cause psychological issues like schizophrenic symptoms? I've never seen any research on that, Maria, but that is, because manganese plays a major role in how we regulate blood sugar. What we do know about schizophrenia and flares in schizophrenia, if you will, a lot of times it has to do with major blood sugar fluctuation. So there's sound biochemistry behind the potential that is true. I just haven't seen any research publications that make that claim directly. Big question, Barbara. So you're doing okay on nature or an NP thyroid, then the doctor switched you to Armor and your heart started racing. So now she suggests to try only T4 synthetic. My Hashimoto's antibodies also up lately. I would say, number one, check the medicines, any of the medicines you're taking, and make sure they don't have corn derivative in them, because a lot of the thyroid medicines have a form of gluten in them that I have seen cause people's thyroid antibodies to go up. So that's one thing to investigate. The other thing I would say, it could just be that that when they made the switch with you, that the dose on the switch was too strong, because your heart racing is usually, that's an indicator that you're being over medicated. So before trying a new one, you might just ask about the potential for lowering the current dose of the one that they switched you to, or taking that out over a number of months and just kind of making sure they can adjust your dose accordingly. Because when you switch a medicine, sometimes the doctor's got to monitor you over a period of 6 months to really kind of get the dose dialed in right for you. And so that's where I would ask. Acid, it's actually a very important amino acid that is critical in immune function. It's one of the amino acids that many people that get fever blisters will use lysine at the first sign of a fever blister at higher amounts to help the immune system battle that virus and put that symptom to bed. Very effective, lysine. You got to be careful in the cereal world. As in the 1940s, that this was a time in our country's history where 8,000 people every year died from B vitamin deficiency as a result of eating cereal grains. The reason why we fortify cereal grains with vitamin B1 and B3 and iron has to do with the mass malnutrition that those grains were responsible for causing. And so the fortification of the cereal industry only came in 1943. Understand, we've had gluten sensitivity dating back, as far as we know, back beyond 2000 BC. So the earliest evidence of celiac disease in the historical medical literature is 2000 BC. The celiac affliction, though, has been around a lot longer than iron fortification of cereal-based foods. So it's not to say that iron fortification of cereals might not be harmful for some, but gluten sensitivity, is not caused by iron fortification of grains. What nutrients or neurotransmitters are depleted by over-the-counter drugs like Allegra and loratadine? So for the most part, Allegra and loratadine, I would be concerned about the subsequent effect that it's going to have on the ability for quality stomach acid production. And in that regard, it's going to potentially limit protein absorption and mineral absorption. And so, think of protein, calcium, magnesium, selenium, chromium, copper, zinc, etc., as possibly all being affected or impacted as a result of using those medicines for long periods of time. Those medicines also dry out the production of saliva, which will reduce certain enzymes that we produce in the saliva, which is going to reduce our capacity at digestion. So enzymes like amylase and lipase, which help break down fats and carbohydrates in the food. So, overall poor digestion problems would, as opposed to very specific nutrient deficiencies. How can someone reverse malnutrition, and how can I get whole house water filter in a bathroom or kitchen water filter? So, reverse malnutrition, you got to understand why you have malnutrition. I mean, it depends on why you have it, Dwayne. So if you have malnutrition because your gut's damaged, then you have to figure out what's damaging your gut. So that would be one aspect of it, right? And then the other would be if you have malnutrition because you undereat, then you have to eat adequately. And if you have malnutrition because you have a limited diet, then you have to figure out where those limitations are and expand your diet and your palate so that you can incorporate more of the nutrients that you're missing into your diet. There's certainly supplementation that you can do. My advice on anyone who suspects malnutrition is though, number one is find out why, and then number two is have your nutrition status checked so that you can get really granular about what nutrients that you might need more of, and then try to accomplish a lot of that with your food, and then accomplish some of that possibly even with supplementation if necessary. As far as a whole house water filter, good, depending on where you live, a good carbon KDF filter is a solid way to filter your water in your whole house. If you're talking about like a kitchen water filter, some of these reverse osmosis units are probably the best. And, there are hundreds of companies that sell these different types of filters. The technology is pretty comparable across the board. So find a company that has a good reputation, has good reviews, has good customer service, and supports and believes the way that you believe, and support that company. Can heavy menstruation, can heavy menstruation, I'm assuming you mean cause anemia, and do you recommend any supplements for it? So if you have a heavy menstrual cycle every month, ladies, and you find yourself like the week before your cycle really, really tired and wiped out, mood swings, cranky, irritable, you might, if you have heavy blood loss, you might be iron deficient and be developing what we would call a transient anemia, where you go through the cycle and then you have that blood loss, and then you have this lull of iron, and your body has to rebuild your blood supply, and that takes a couple of weeks. So by the time you're rebounding from your cyclic anemia, you're going back into your cycle again to have anemia. And so that transient up and down is a very, very common effect in women. So number one, yes, you can supplement iron in those situations where, especially, and it's an easy test, ask your doctor to measure your iron, do an iron panel, and also have them look at your ferritin. And if your ferritin and iron are super low, then you may, with all that blood loss, you may look at iron supplementation as an answer to that. And so what I have seen be effective for many women is not supplementing iron every day, but is especially supplementing iron for 1 to 2 weeks out of the month to preemptively help them support their hemoglobin production as a result of the blood loss they're going to have. Now, if you have very, very heavy cycles, there may be a hormone disruption that's causing you lots of blood loss. And so I've seen cases too where a woman had an underlying issue that was causing heavy menstrual bleeding. And so it's, again, why is the iron low? The iron's low because you're losing blood. Well, why are you losing excessive blood? and many women do. They have an excessive blood loss during their cycle, and that can normalize if you figure out what's driving that. And so, I've seen gluten be a primary driver of excessive blood loss for menstruation. And going gluten-free, I've seen a lot of women where their cycles really tapered off and their symptoms they still had symptoms of PMS. I don't think that we're trying to solve or cure that, but because I don't think it's anything to be cured. But I think there's a difference between normal PMS and like progressive PMS that's being caused by malnutrition and other problems. And so again, if you've got heavy blood loss, you might want to look into certain things like diet change to see if that regulates it. In my experience, gluten-free diets do wonders for abnormal menstruation. If you're following a true gluten-free diet and taking most of the micronutrients you need, what can still cause your energy deficiency? So if you're following the diet and you're even supplementing with like a good quality multi, and you're still tired, there's a lot of things that can cause your energy to be low. And one of them could be that you have other food reactions beyond what's illustrated in the true gluten-free diet. I see people all the time that are reactive to what they would call superfoods, right? Broccoli and cauliflower and blueberries, etc. So you could have other food reactions that are dragging you down. You could also, even though you're supplementing with micronutrients, you could be under-supplementing. You could be not getting adequate quantities. I mean, a perfect example would be if you had a major or severe CoQ10 deficiency. Even if you were taking, let's say, 50 milligrams of CoQ10, it might not be enough to correct the deficit that you have. Generally it takes 200 to 300 milligrams a day of CoQ10 to get a good correction on a deficiency. And so, those things would be areas I would say investigate first. Investigate food reactivity, investigate your nutritional status to determine whether what you're doing is hitting the mark. Do I have an opinion about anorganic antimicrobial? And, so if a person, for example, has a major yeast or bacterial overgrowth that is affected by sulfur, then that might be very helpful for that individual. But as a general, let's just do this to do it. It's not saying, I don't really recommend it in that way. I don't know if your question, if there's a language barrier with this question, what is a cholinesterase test serum measure? So if you're talking about cholinesterase, that's an enzyme, but you got to come at me with a more specific question, because you're saying, what is a cholinesterase test serum measure? It measures cholinesterase in the serum, and that I don't know how to answer you beyond that. If there's a specific aspect to maybe why somebody would order that type of test, maybe throw that question in there. I can give you a better answer. Yeah, so best type of testing to find nutritional deficiencies is something called lymphocyte proliferation. And as far as chemical exposures, same thing, but more specifically lymphocyte response. So these are two tests that can measure. So there's two ways to measure chemical exposure, though, I will point out. So one is to measure whether or not your immune system is reactive to certain chemicals, and another way to measure for chemical exposure is just to measure for those chemicals and see if your body has accumulated high levels of certain chemicals. And that kind of testing is very broad. There are a number of different types of ways to go about that, so it's not like one particular test. Are cobalt and vanadium essential, and what foods have them? Yeah, they're both essential, and nuts and vegetables and meats and liver, all rich in cobalt and vanadium. What's the best, most stable fat for cooking? So it's not one best. I don't like to get it rung into that whole what's best, right? But because there are a number of different fats that are heat stable. Coconut, avocado are both heat stable, but many people are allergic to coconut, so for them that would be a bad choice. I think beef fat or duck fat are two probably the best, most heat stable fats for cooking. A lot of people dismiss the animal fats because of the 50 years of of lies and misinformation about dietary fat being a primary driver for heart disease, especially dietary saturated fat, which is what beef fat and duck fat would represent. But if you want something that's heat stable, that has rich nutritional value, you'd want to go with those types of fats, predominantly making sure that the animal that you're sourcing the fat from was also a healthy animal, because if the animal you're sourcing the fat from came from one of these feedlots, you don't want that type of fat. Should we eat carbs, fats, and proteins separate from one another or mixed together? I think if your gut is robust, you should be able to eat them all in combination without worries. Now, some people do what's called food combining, where they will eliminate, eating them together because they tolerate them in separate, but it's very hard to separate out 100%. So like as an example, any kind of animal meat's going to also have fat, not so much carbs, but so you're going to get fat and protein in that. Any kind of nut is going to have a mixture of carbs, fats, and proteins. Most vegetables contain protein, as well as, depending on the vegetable, fat and carbs. So there's always, food is generally, there are very few foods that are just specifically one macronutrient without the others. Fruit, probably one of the best examples, because predominantly fruits are carbs. But whether or not you would benefit by separating them out is unique to the person, but it's not something that I just generically say everybody should seek out not mixing them, because I think your digestion should be robust enough to handle all three. Recommendation for anxiety, sweating of the hands and feet. Find out what's triggering your anxiety. That's simple. Sweating of the hands and feet like that's driven by anxiety. And so that's a sympathetic nervous system response. So what's putting your nervous system into a hypersympathetic state where that's happening? So you have to reverse engineer why the sympathetic response is turned up. For many people, it's because they're eating foods that they're reactive to. For some people, it's bad relationships or extra stress at work or lack of sleep or environmental poisons that they're being exposed to that's driving an immune system response in their nervous system. So you've got to figure out what those things are and deal with those. Some people will take, supplements like theanine or GABA or ashwagandha or eleuthero. These are what are called adrenal adaptogens that can help you cope and adapt with stress, but they're not going to solve the why. And that's what you want to go after, is the why. Everybody's interested in what can I take to correct the symptom. Get back to why does the symptom exist, and you'll have your answer. Thoughts on using MSM to help relieve joint stiffness? I think MSM is a very effective supplement. How does King coffee differ from organic whole bean coffee? It's the mold issue. If you're talking about a low fermentation diet, it's the mold issue. A lot of coffees are mold contaminated, and so you have to be careful when you have a mold problem or a yeast problem that you're not consuming coffee bean where there's a known potential for mold or mycotoxin ingredients in that coffee. So hopefully that answers that question for you. So Raven says, strictly GMO-free brown rice, yellow and white corn. Is this safe to eat? Look, if you're trying to follow the no grain, no pain diet, if you're trying to follow a true gluten-free diet, no. Brown rice, yellow corn, white corn, wheat, barley, rye, oats, corn, rice, sorghum, millet, teff, triticale, buckwheat, amaranth, quinoa are all out. No matter how you look at it, whether it's GMO, whether it's sprouted, whether it's non-GMO, whether it's organic, if you're trying to follow the no grain, no pain diet, those things are out. Do you think that mitral valve prolapse without regurgitation can cause left atrial enlargement? Yes, possibly. And how serious is this condition? Well, it can get very serious as time goes on. A lot of doctors with that type of issue put people on blood thinners. I don't know where your doctors got you, but just some things to consider on the natural world order of it is, your doctor can measure your blood viscosity. So why would the doctor want to put you on a blood thinner when you have a regurgitation like that? It's to prevent any kind of clots from backtracking and putting you at risk. So you would keep your blood thinner, but there are natural things that you can do for your blood to be healthy. And so, one of those is fish oil, getting enough fish oil, omega-3, especially EPA. Most fish oil brands are DHA rich, but don't have adequate EPA. And EPA is what helps regulate blood viscosity. So making sure you're getting the solid EPA, omega-3 in that situation. Vitamin E and selenium and vitamin C are all naturally help keep your blood viscosity healthy. There are tests that you can also ask your doctor to measure for your blood viscosity, things like D-dimer and fibrinogen, prothrombin time. There's actually a serum test called serum viscosity that measures the viscosity of the blood, and that can help you understand better, kind of how to be as preventative minded as possible in that type of scenario. I suffer from carbon dioxide in water, even variants of water with less carbon dioxide, diarrhea, leaky gut. I would doubt that's what you're suffering from. I don't think you're suffering from carbon dioxide in your water. I think maybe, I don't know where you've read that or why you think that. I don't even know how to answer that. It doesn't make sense to me. I would say if you're still struggling with, if you're celiac and you have DH and you're still struggling with diarrhea and leaky gut, I would encourage you to read No Grain, No Pain if you haven't already, and really, really apply that diet, because it doesn't make sense to me to say that you're suffering from carbon dioxide in water. I mean, maybe I'm misreading your commentary and your question, and if I am, please ask it in a different way. When to test toddlers if mom has celiac? At birth. When to test babies? At birth. It's a cheek swab. You swab the cheeks. There's no blood draw required to get gluten genetics done, even on infants. So if mom has celiac, you want to know right away, because if the mom is going to start introducing foods to the baby, usually one of the foods that pediatricians recommend first is grain, right? Grain-based cereal foods, the baby cereals. And so if that baby's got a gluten issue, you certainly wouldn't want that to be what's being introduced. The other issue is if mom's not breastfeeding, then you're talking about the formula milks. And a lot of the formula milks have corn and gluten. So, again, test that baby as early as possible. Are people having issues? I think I answered this question already. I think specifically, is there a test to measure GABA? Yes, there is. Some of the tests that measure GABA are urinary output tests. You're talking about GABA, gamma aminobutyric acid. I did your gluten sensitivity genetic testing a while back and would like to review the results with someone on your staff. Who can I contact? Contact Malaya, glutenology@gmail.com, and she can set you up to attend one of our webinars where we help you understand what that result means. Had a colonoscopy, gastroscopy, and it came back negative for celiac. However, I think I might be gluten sensitive. Unfortunately, my GP is a bit ignorant. When I mentioned a DNA test, he laughed at me. I mean, if he's laughing at you, shame on him, first of all. Your doctor should never laugh at you. I mean, what an asshole, excuse my language, but that really makes me mad when doctors treat people below them and look down. I mean, if you look at the track record of medicine in the last 70 years, if anybody should be laughing, it should be all of us, laughing at how poorly we've been treated, actually crying more than laughing, how poorly we've been treated in this, and look at this scope of how illness has rampantly raged across industrialized nations as a result of the failure of doctors who want to laugh at you. These guys are jerks. Yeah, so, okay, sorry, I ranted there for a minute, Darren. If you're in Canada, reach out to Malaya. We can ship you the DNA test if you want to get that testing done. We can ship all over the world, and we may even be able to drop ship it to you where the cost of shipping is not a barrier to you wanting to do the test. So reach out to Malaya and she can help you navigate that better. And again, her email is glutenology@gmail.com. Laurie says, my son is celiac. Prior to diagnosis at the age of 2, he's now 21. He had constipation. Now if he gets contaminated, he gets violently ill. How can I support him when he's contaminated? I think the best thing to do, Laurie, is to make sure he is more cautious about how he navigates eating out. I mean, at 21, I can imagine at that age, he's probably trying to be social and eat out and do the things that most 21-year-olds do. He's got to weigh the risk of that with his health. One thing he can do ahead of time is use something like a gluten shield. Again, it's not giving him permission to go eat gluten, but it may help protect him from any kind of cross-contamination exposure. Beyond that, I think do we have a video protocol on what to do when you get gluten? I think we have a video protocol too, Laurie, so we'll share that in the feed below for you to share with your son. Do I have a multivitamin for a person who has a difficulty swallowing pills? Yeah, it's called Ultra Nutrients. What you can do with that, Aang, is the capsules, you can just twist them and break them open and dump that powder, and you can make like a smoothie, or you can put it in liquid and just drink it, and that makes it a lot easier. But it's not going to affect the absorption. It's not going to affect the quality of the. If you open that capsule, it's not going to affect the quality. Can mercury toxicity wipe out your stomach acids? I had 3 amalgam fillings drilled out last year from my regular dentist and experienced anxiety and depression and caffeine intolerance. Yeah, I mean, it can damage you. I mean, mercury is a toxin for sure, and it's a neurotoxin, and that's probably why you experience the anxiety and the depression. I mean, if your dentist drilled those fillings out and didn't protect you by damming your throat and putting the proper fans up to protect you from the mercury exposure, he could have contaminated you and made you sick. So yeah, I mean, I hope you're feeling better at this point. But you might also consider getting with a doctor and asking them to measure you for mercury toxicity, and then maybe potentially chelation might help you as well. You may go back to and watch our show on metal toxicity. We can put a link below for that show. Do I suspect that everyone with mold toxicants have candida and parasites? No, I don't, and I don't see that to be true either. I know a lot of people on the internet are talking about how if you're in mold, you're also going to be guaranteed to have those problems, and it's not anything I would say I can clinically validate. Some people do, and some people don't. How does celiac disease affect your optic nerve? Well, gluten is a neurotoxin, and it can damage the nerve itself, and it can damage the ability to produce myelin. We did a show on gluten affecting the eye. Actually, I have a pretty comprehensive article on that. We can maybe put that up for Mila, and I hope to say your name right. Is it Mila or Mila? I'm not sure, but and that will help you to understand those connections a little bit better. How do you know if you need magnesium? I mean, the best way definitively is really to get good testing done. Some people take magnesium supplementally and they feel better. I mean, that listening to your body is another kind of good thing to follow. Would not taking manganese with magnesium contribute to painful numbness in the hands at night? Probably not. I mean, without testing, it would be hard to say, Rye. If you're struggling with painful numbness in your hands at night, there are a number of possibilities that could be, and I just would encourage you to get with a functional doctor and get some testing done, and don't mess around with that, because neuropathy, the longer you leave it and don't solve it, the harder it is to solve. and the longer it takes to recover. I'm on a gluten-free diet and have a rapid heart rate or a fast heartbeat. Is this concerningly bad? It can be. I mean, if you measure your pulse rate, you know, generally a healthy pulse rate's between 60 and 90, and that's a pulse rate if you're measuring it at rest. But if yours is higher than that, then you definitely want to look into other potential possibilities, you know, even beyond gluten. You know, because of rapid heart rate or rapid heartbeat, you know, that's a sign that your immune system is potentially being threatened. It's also a sign that you could be being exposed to some things that are sending your body into kind of an adrenal reaction. So you're making, you know, a lot of these people that have elevated heart rates have an increase in epinephrine and norepinephrine, or adrenaline and noradrenaline, which are, again, hormones that can work your heart over. And if they're elevated over chronic periods of time, I mean, it does definitely have negative side effects. What do I look for when choosing a functional doctor in my area? I'm celiac, diagnosed 5 years ago, and all my true knowledge from this disease comes from you in your book. Great question. You know, we took down our physician listing because even after going through the process of making many physicians go through the training, our, you know, Gluten-Free Society training, what we found was they weren't following the training. They would go through the training and then do their own thing, and then our followers would come back to us and say, hey, the doctor you recommended didn't do it. You said, you know, didn't do what you generally recommend. And so I'm a little confused as to why you had him up on your site. So we took down our doctor database for that reason, because, you know, unfortunately, you know, you can go off of a list of functional medicine doctors. There are a couple of lists out there, but at the end of the day, it's hard to know what you're getting. So how do you evaluate for a functional doctor? I would say several things. Number one, they have to have great bedside manner. So maybe an initial meeting or an initial visit with one might help you establish that. But if you're just looking to say, okay, should I even schedule the appointment? I would say go to their website, look at their reviews, look at their rankings. How long have they been in practice? And of that practice, how long have they been practicing functionally? Because some doctors, look, they've had a traditional practice for 30 years and they're just now getting into this functional medicine thing. And so, you know, just because they've been in practice 35 years doesn't mean they've been practicing functional medicine for 35 years, and that you want to be careful of that. So ask them how long they've actually been practicing functionally, not how long they've just been practicing. You know, and those are great places to start. You might also ask questions to their staff about philosophy. So to me, you know, if somebody calls my office, you know, and the line of questioning is along the lines of, you know, does the doctor give me something for pain, or does the doctor give me something for nerve issues? Or, you know, it's like our answer is always going to be no. We're not going to treat your pain, and we're not going to treat your symptoms. We're going to help you ascertain why they exist. And if you're fielding a doctor's office and that's not what his staff is resonating or her staff is resonating to you, you know, you might consider that that's not functional. Because, you know, the problem today is so many people are claiming now to practice functionally, and they're not. They're practicing green medicine, which is not functional medicine. Green medicine is giving you natural things to suppress your symptoms instead of drugs, and that still doesn't help you. It basically enslaves you to having to take pills. You know, the good functional practitioner is going to help you understand why you are struggling and help you understand and empower you so that you can make meaningful diet and lifestyle changes to take control back over your health. And if they're not doing that, they're not practicing functionally. They're liars if they're not doing it that way. And they're claiming to do it that way, or they're claiming to be functional. Should women over the age of 65 not take T3? I mean, no, there's nothing magical about turning 65 and not being able to have or, take T3. I think the issue with T3 is if you're getting too much, right? Too much thyroid hormone can elevate your pulse, elevate your heart rate, elevate your blood pressure, keep you awake at night, cause you to lose your hair, cause your skin to dry out. It's not a good thing. So I think it's just more a matter of, are you taking an appropriate amount? And, to know that, you have to have a doctor who's, monitoring you and doing regular blood work, to assess your not just your TSH, but to assess your thyroid, your T3, your T4, your reverse T3, your iodine levels, whether you're being exposed to chlorine and bromine, the other nutrients involved in helping your body produce its own thyroid hormone. Like, these are all important to measure if you're going to try to assess that properly. I'm true gluten-free. Is there anything I can do to improve my large red blood cells? Well, if your red blood cells are too big, that's called macrocytic anemia, and a lot of times that is caused by a folate or a vitamin B12 deficiency. So, you might consider getting those things measured to see whether or not that's what's behind your large red blood cells. Can gluten cause mood disorder? Absolutely. Anxiety, depression, schizophrenia, bipolar, ADHD, ADD are all linked, have all been linked, in both clinically and in research, to gluten-induced damage in the nervous system. Are you a fan of food sequence eating, such as vegetables first, then meat and proteins, and then carbs? No, I'm not. I think if you're focused on food sequencing, then your gut is so destroyed and so weak. Now you've just created another layer, another level of stress for you to deal with around the meal table. I'm a fan of figuring out what you should or shouldn't be eating, and then embarking on a quest to heal and repair your GI tract so that it becomes robust, so you don't have to worry about the nuance of sequencing your food. Lisa, I don't understand your question. Adrenal flush for out of the blue. You have to reword that. In your practice, do you test to determine degree of sympathetic nervous system activation? Yes, there are different types of tests that give us an understanding of whether that's happening. How much consumption of foods with oxalates is too much? It's not how much is too much. With oxalates, if you're oxalate heavy and you're oxalate burdened, I would shoot for, trying to keep your oxalate burden at the very least under 150 milligrams per day. Because a low oxalate diet is not a no oxalate diet. Some people will go carnivore, and that is closest thing to a no oxalate diet as you can get. But if you oxalate dump, you can have severe consequences. Trying to stick to a low oxalate diet, and you definitely want to be, probably somewhere 100 or less milligrams a day of oxalate in your food as a max. But I would also, encourage you to focus on avoiding foods that are highest in oxalates, things like spinach and almonds. We have a list of high and low oxalate foods on Gluten Free Society if you want to check that out and use that as kind of a guideline for you. Can taking serrapeptidase help dissolve scarring in the liver? If you've got, your liver can heal. Your liver, when you say scarring in the liver, how was that verified? If that wasn't verified through biopsy, then that's just speculation that your liver is scarred, because you can see imaging, like ultrasound imaging on a liver, and you can see things like appearances that are cirrhotic in nature or fatty in nature, but it doesn't necessarily dictate that you have scarring. So, again, depends on whether or not you have scarring or whether you have fatty or cirrhotic cells, in which case the only thing that's going to reverse fatty and cirrhotic is figuring out what caused it. Serrapeptidase is an enzyme. It's a proteolytic enzyme that can be very helpful for a lot of things, but it is not going to solve why your liver is struggling. R32 Smith and Wesson Long wad cutter sufficient for self-defense? Mark asks. You know, my favorite mark for self-defense is a judge. And what I like to put in it is if you're not familiar with the judge, it's a Taurus pistol, and it shoots both 45 and it shoots also 410 gauge shotgun. And so I put high-powered pellet in the shotgun shell on that, and that way, if it's in the dark and I need home defense, I can shoot. And if I'm not a great aim in the dark, I'm going to hit something. That's not really nutrition related, though. So Donna, on the follow-up, thanks for the answer on my toddler. Would we test with the doctor, or would we test with Gluten Free Society? I mean, you could test with either one. It just depends on whether or not your doctor's willing to do it. One of the reasons we offer the test is so many doctors are unwilling to do it. It's like the one comment earlier where the woman's doctor laughed at them, and that's part of the problem. Is doctors are so egotistically driven. They can't admit fault. Not all of them, but many of them can't admit fault, and certainly aren't gonna tolerate somebody else that is a patient being smarter than they are. Even though it's the job of the doctor to learn from the patient, is just as much as it is the job of the doctor to teach the patient. It's the job of the doctor to learn from the patient. My DNA test came back as HLA-DQ alpha 105. Why does my endocrinologist have HLA-DQ on my charts? Because HLA-DQ alpha 105 is an HLA-DQ2 marker. That's why he has HLA-DQ2 on your chart. Yeah, so, is an elimination diet better than food sensitivity testing? It's not that it's better, it's that it's limited. If you've done an elimination diet and you're still struggling, and that's where many people are, then food sensitivity testing is the next logical place to go, so that you can rule out things that your elimination diet didn't help you with. Remember that the window of a reaction to a food can be up to 3 weeks long, so elimination diets oftentimes don't help you to address or figure that part out. Yeah, I love that comment. I mean, I don't love it. But it's very common. Melissa says, I recently diagnosed with celiac disease and contacted the Celiac Foundation here in Canada with registered dietitians, and they sent me coupons with toxic chemicals. You got to remember that this is not true of all registered dietitians. And so if you're a registered dietitian watching this, don't take it personally. But as a profession, that profession is largely captured. I mean, their organization, the ANA, is largely captured by corporate greed. I mean, their number one funder, I think it was Coca-Cola and Oreo cookies, the maker of Oreo cookies. I mean, these are their major funders, and you can't tell me that an organization that allows for crap food to fund them is going to not have a bias of opinion and is not going to be influenced by that donation. It's why Gluten Free Society does not. You'll never see a sponsor on our site. You don't see ads. The only ads you'll see, if you see any, are going to be ads to the products that Gluten Free Society offers. But we don't let sponsors come in and dictate our decision process and our decision making in an unethical way, where we're allowing that financial influence to influence the information that we give to you. I mean, integrity first. Profits are great. Anybody working a job or running a business wants to be profitable and have enough money to take care of their families, but profits should only come when you do well and you do good by people. They shouldn't come at the cost of potentially hurting others, and that's the conundrum that many of these companies get into as they lose their way. Any guidance on vertigo? Depends on why you have it, Lori. Go gluten-free if you haven't already. Vertigo and cerebellar ataxia can both be triggered as a result of gluten exposure, because gluten can damage the inner nerve, or the nerve of the inner ear, but also areas of the brain that regulate balance. So, that would be a place to start if you're already there. You might check out the Epley maneuver. If you've got a good doctor that understands how to help you with an Epley maneuver, sometimes vertigo is caused by the crystals in the inner ear being stuck or becoming stuck, and so an Epley maneuver can sometimes unstick them. What can you eat in place of bread if you're gluten sensitive? Fruit, nuts, vegetables. But if you mean like a bread substitute, we do have, Rose, something called Warrior Bread, which is it's as close to traditional bread as you can make a gluten-free bread taste. We worked on it for years to get the formulation good, but try it out, Warrior Bread. Maybe we'll put a link below for you. And we have I think, 50 recipes of different things that you can make with it. So it's not just a bread mix. It's also almost like an all-purpose flour that you can use to make a lot of other things. Go down on that left side for me. Keep going, keep going. Somebody said, I guess people with Lyme aren't important. Was there a question about Lyme that I missed? If you've got a Lyme issue, you need to work with somebody who understands Lyme and make sure it actually is Lyme. I can't tell you, Justin, how many times I've seen people who were diagnosed with Lyme that didn't have it. They'd been on antibiotics for years as a result of the diagnosis, and then when they changed their diet to a gluten-free diet, all of their symptoms went away. So I think it's important, if you've been diagnosed with Lyme, to confirm that you actually have it. I think if you haven't changed your diet, a lot of people understand that if you do have Lyme, one of the ways to beat it is to make your immune system strong, because your immune system is going to be largely more responsible for beating it than any drug you can take. And if your immune system is so preoccupied with foods you're allergic to or reactive to, you're never really going to have great success. So get your diet squared away first. And you want to learn more about the gluten-free diet and the grain-free diet, then check out No Grain, No Pain. You can check it out at your library. You can pick it up at any major bookstore. You can buy it on Amazon. But that book will give you kind of a blueprint to begin the process. And then once you're in 4 weeks into that, come back here and let us know how you're doing. And if you're doing better, victory, we can virtually high five. And if you're not, I can give you some other kind of pathways to maybe potentially go down. Okay, I'm going to go have lunch. Look, I hope you guys got value out of today's show. Again, a reminder, don't forget to support us. You can go to glutenfreesociety.org. If you're not already on our newsletter, you can sign up there. It's free. And we'll send you tons of great and free information. We'll also send you reminders about when we go live. There were several questions in the feed today about what time and what time zone. We are Central Standard Time Zone when we go live. Typically today is different because I had to take yesterday off, but usually we're here Thursdays at 12:30 Central Standard Time, and then we're here again on Tuesday at 6 p.m. Central Time as well. So make sure you come visit me at Gluten Free Society and take advantage of all that great and free information. And hey, if you want to support us, hit the like button, hit the subscribe button, share this with 100 people, and use our products. That's how you support us. Thanks so much. Have a fantastic weekend.